during the pandemic when the governor laid us off here in the great state of Texas. We were off, I think, a total of maybe 75, 90 days. We were off.
Oh,
Which I
wow.
was scared. I didn't know what was going to happen. I didn't know if I was going to be able to come back to a practice. I didn't know what was going to happen. I didn't know if the world was going to shut down or
That's
what.
right.
But the thing that really got me was that, you know what? I'm sitting here with one source of income. I just have this dental practice and I don't know what's going to happen to it. What am I going to do? Because I'm really only a one-trick pony. I can do one thing well. I said, you know what? I'm never going to do that again in my life.
Welcome back to another episode of Jarvis Hill Projected. I'm excited. Why am I excited today? Because I have a very special guest. Before I bring her on, let me bring her on right. So, as one half of the Center of Endodontics and Periodontics and Implantology, Dr. Robertson received her bachelor's degree and dental degree simultaneously from the University of Missouri, Kansas City as part of an accelerated degree program. Check this out, guys. She then worked as a general dentist for 3 years before returning to the University of Missouri for an advanced education program in periodontics. According to Dr. Robertson, her experience in general dentistry greatly enhanced her ability to serve her patients as a periodontist. In addition to providing treatment for gum disease, much of Dr. Robertson's surgical practice is cosmetic focused, including procedures such as gum lifts, gum grafts, to treat recession and dental implants. We got to get into all this. Dr. Robertson inherited an eye for design, her skilled ability to use her hands from both her mother, who could design and sew just about anything, and her father, a skilled carpenter. As an adult, she applies these talents along with her love for science into periodontics, and she loves that her chosen career allows her to combine both art and science. Welcome to the show, Dr. Robertson. How are you?
Thank you. I'm well. Thank you. Good morning. Good morning.
Man, listen, this is amazing. You know, I've never talked to a periodontist, endodontist, and someone of your stature. And I tell my audience is we're going to bring on professionals and experts to learn about all kinds of stuff. And I'm super, super excited to talk to you about this because we got to talk about, how does this pack, and, you have a beautiful smile and all this, but we want to help everybody else out, and that's what we're about. So thank you so much for joining us.
You're welcome. Thank you for having me.
So let's get down to business, as I always like to say. And let me tell everybody, so if you guys are new to the show, please be sure to like and subscribe. So let's get down to business. How did you choose this industry?
Oh, initially, Jarvis, I actually wanted to be a pharmacist and just going through high school. But I actually went to a dental appointment with my mom. And he was an African-American man that actually spent a lot of time with me. He allowed me to ask questions. He allowed me to sit chairside with him. He allowed me to sit at the front desk, help answer his phones, whatever the case was. His name was Dr. Dwayne Dilworth. And I actually think he's still practicing in the St. Louis Metroplex.
Oh, wow.
But basically what he did was he allowed me to come in and just hang out with him and do what I wanted to do. And he asked me what I wanted to be when I grew up. And I told him I wanted to be a pharmacist. And he asked me, have you ever considered dentistry? You see how much fun we have here. You see how life-changing this career can be. Why don't you try it? And when I thought about it, when I looked at what he did and I realized how much fun I actually had going into the office and hanging out with him, I thought, you know what, I'm going to try this. And I told him I wanted to try it. And he actually gave me a couple of dental books. Now, of course, I didn't know what I was reading, but he allowed me to take them home and look at them. And it just kind of developed my love for dentistry. I've always liked science, so I thought pharmacy would be a natural fit, but dentistry turned out to be what it was.
That's amazing. That's absolutely amazing. Shout out to him. Do you ever reach back and I'm assuming he knows that you're in the field and doing quite well. I'm assuming he knows that.
Absolutely. I actually still talk to his wife. I really do. I talk to his wife more than I talk to him, but I do still keep in contact.
Oh, see, I love that because when you hear how people can have an impact on people, you just never know how sharing something and sharing some information can have a positive impact. That's amazing.
Absolutely.
So can you describe, because we got to get into it. So describe some of the procedures that you do as a periodontist. What does it look like?
Well, everybody knows about the one procedure when you have a missing tooth, we place dental implants.
Yep.
But not everybody knows. Well, and also everybody knows gum disease, right? So sometimes when you go to the doctor, to the dentist, and you have, gum disease that may be a little bit more advanced, they'll say, you know what, you got to go see a specialist because we can't handle it here in the office. It needs the specialist to see it. So we treat gum disease. We place dental implants. When you have a tooth that's broken or fractured, sometimes it has to come out. We'll put bone graft in to maintain the bone, maintain the healthy part of the bone. Sometimes if you have gum recession where your gum is kind of pulling back and your tooth looks a little longer, sometimes we have to put gum tissue on there to kind of cover that tooth up again because it can be more prone to decay or it can fall out. So we just kind of help stabilize the foundation of the teeth. And honestly, a lot of the stuff that I do is underneath the gum line. So you really wouldn't be able to see it unless you had an x-ray taken.
Ooh, hold on a second. So you let's slow it down because you shared a lot of good information. And I always like to try to take my notes. So let's break it down, gum disease, because it's high level. We can understand, like when people say gum disease, that's an easy catchphrase. But what does it look like from a person like who may not know what that is? So we're brushing our teeth every day. We may be flossing, but I may still feel some irritation or something. I don't know. But what does it look like? How do I identify that as a regular person who doesn't know anything about gum disease?
So I'll give you a scenario that I always tell my patients. Basically, gum disease comes like this. Let's think about it as like when you have Christmas dinner and your grandma or your mom makes these collard greens, right? And she makes collard greens with this smoked turkey and she puts them in the refrigerator. Okay, but that Tupperware sits in the refrigerator and we don't find it until Easter. We pull it open and what's that smell, right? What's that horrible smell? But what that is it's just the bacterial stuff that's been able to happen. It's just the multiplication of the bacteria that have been able to happen. So they've been able to build and grow and we find it and now it smells really bad. Well, that's the same thing that happens in gum disease. You got all this bacteria that are living in your mouth because besides your hands, your mouth is one of the dirtiest places on your body. It's full of bacteria. So all these bacteria, right? If you don't cleanse your mouth and get all that stuff out of there at least twice a day, that stuff will line up around the gum line and then get underneath the gum line and sit there for a long time. And so when you talk or when you speak in front of somebody, somebody's like, oh my gosh, his breath stinks, her breath stinks. That's because that's that bacteria that's been underneath the gum line. Yeah, it hasn't been disturbed. It hasn't been removed because you haven't flossed, you haven't gone to the dentist, you haven't done anything like that. So it's important to actually get your checkups once every 6 months. It's important to floss. It's important to brush. But that's really what that is. That's what gum disease is. It's just bacteria that's been allowed to sit underneath the gum line for a long time.
I told you guys that we're going to get you guys educated. I bring on the experts and she just broke it down. So not only do you make sure you floss and brush every 6 months, get that checkup.
Yes.
How does this overall impact your overall health, or does it play a role in your overall health?
It absolutely does. So we know now that gum disease definitely has something to do with heart disease. We've linked it to cardiovascular disease. We've linked it to the health of your brain, so strokes, things like that. They think it even has something to do with dementia. So absolutely, what they say is the bacteria in your mouth, they get into your bloodstream. And so what they found when they've done some exams on, of course, cadavers or people that have died, they've done some research. They've done what they call section the aorta, and that's just a part of the heart. That's a large portion of the heart where the blood kind of flows through. Well, if that bacteria is inside the blood, it actually gets trapped inside the aorta. And so they've seen that when they look at the aorta underneath the microscope, they found the bacteria from the mouth inside there. Wow. So they know that things can happen with the heart. It can damage the heart. It can definitely damage the vessels of the brain because the vessels of the brain are a lot smaller, right? And so it'll get trapped in the vessels of the brain and create things like dementia. You can actually get blood clots from it. You can have strokes from it. So dental bacteria is nothing to play with.
Absolutely, because this is my first time ever hearing this, that your dental hygiene can impact your heart. That's what we're talking about, and your mind.
Yes.
So we're running around here trying to do all these different things and not realizing maintaining having a healthy dental practice, or make sure you're brushing and flossing every single day. I mean, do you recommend because I've heard like 2 times brushing 2 times a day and flossing? Like, what is your recommendation of a system that we can practice?
It's definitely going to be brushing twice a day, flossing once a day. Basically, I recommend flossing right before you go to bed. Okay. What you don't want to do is you don't want to have food on your teeth at night, because at that time the mouth is closed. and that's a warm, dark, moist environment. That's the best breeding ground for bacteria.
Okay.
So if that bacteria is using that food between your teeth as a food source, you're definitely going to develop cavities. You're going to develop periodontal disease. You're going to develop a whole host of problems that you don't want. So I would definitely recommend brushing twice a day to clean and cleanse the mouth. But I definitely recommend flossing right before you go to bed. And what I do is I do it while I'm watching the news. Anything that I know I'm going to be doing at a specified time of the day is typically when I'll try and floss.
Hey, so guys, listen, let's pause. She just threw out a couple dimes and some nuggets. Make sure you floss before you go to bed. I mean, actually, it makes sense now that you're talking about it, because if you just had dinner, you brush your teeth, but you still got some things that you may have not gotten out with the toothbrush. Do you use the floss, or do you use like one of the picket flosses? Which one do you use, or do you recommend?
It doesn't matter, Jarvis. I really recommend the floss because it has more of a surface area. That string has more surface area, so you get a bigger bang for your buck. When you put that stuff in, that floss in there, you can basically get it off the side of the side of the tooth, on the left side of the tooth, on the right, and then a little bit on the front. But if you only have the dexterity to use the brushes, it's fine. Just get in there and get something, because honestly, not flossing is like going number 2, but only wiping the cheeks.
Oh, listen, say, come on now. That's what I'm seeing. That's why I bring people on like you to get out and be real with the family. You know, Dr. Robertson, you know, this is what it's about, being real. And that's why the people who follow this show, they say, man, we love your show, because the people you bring on, they're very transparent. They're real. We don't hold any punches. We let it all go. What type of education does a periodontist have to have?
So you have to have the 4 years of college and then the 4 years of dental school. And then beyond that, it's kind of like a residency. You have like a 2 or 3 year program. So at sum total, I think I skipped 2 years because I did college in 2 years. But sum total, if you were going to do it the traditional way, you probably have to have about 11 years of school.
Wow, 11 years of school. So you have to be dedicated. You have to be committed. Now, I'm assuming that you're quite busy. What do you like to do in your free time, or you just think about teeth all the time? What are you thinking about, Dr. Robertson?
Jarvis, I do so much. I actually am super duper busy. I have these 3 kids around here. One graduated from college, one graduated from high school, and one just a junior in high school.
Oh, wow.
So I do that, but I like to read. So if you're asking me what I like to do in my spare time, just alone, I like to read. That's one of my favorite things to do. I read a lot of self-development books.
Okay.
A lot of business books. I do a lot of that. I think it's important to actually develop your mind. Yeah, it's important.
So, you know, that's one of the things I talk about all the time as an entrepreneur or someone who wants to run their own business. The biggest thing that you can do is self-development. Now, yes. I have to ask Dr. Robertson, give my audience one book or one recommendation that you recommend. I know you have many, but just give us one.
3 Feet from Gold.
I would run it. Listen, I would run and get it, but you know, I have that one in my personal library. That is an amazing book. 3 Feet from Gold, guys. 3 Feet from Gold is an absolutely amazing book. We're not even going to tell you about it, but just go out and get it, and you won't be disappointed.
Nope.
What are some of your personal goals that you're trying to achieve this year?
I really would like to create at least 2 or 3 sources of passive income, to be quite honest.
Okay.
And I decided that during the pandemic, when the governor laid us off here in the great state of Texas, we were off, I think a total of maybe 75, 90 days we were off. Which I was scared. I didn't know what was going to happen. I didn't know if I was going to be able to come back to a practice. I didn't know what was going to happen. I didn't know if the world was going to shut down or what.
Right.
But the thing that really got me was that, you know what? I'm sitting here with one source of income. I just have this dental practice and I don't know what's going to happen to it. What am I going to do? Because I'm really only a one-trick pony. I can do one thing well. But I said, you know what? I'm never going to do that again in my life. And so I decided that while I was home, that I was going to start working on some different things. So I actually became a licensed real estate agent, licensed realtor. I don't know what I'm going to do with that yet, but I said, you know what? I'm going to get this in preparation for some other things. I'm also looking at a couple of things to kind of spin off from the practice. I'm looking at opening a dental assisting school soon.
Oh, wow.
By July.
Oh, so hold on. Dental assistant school?
Yes.
Just give us a backdrop of what they look like and how people who may be interested can possibly enroll into your program.
So sure. So certainly. So what will happen is it's going to be a 6-week course. And typically what will happen is we will run the dental assisting school twice a week or on the weekends. It's certainly going to be an option for whichever you choose.
Nice.
Essentially what will happen with the people that come through that program, they'll have the knowledge to go out into the world to actually use that as a career. Dental assisting is very lucrative. It really is. And really the dental assistants are the backbone of the entire office. But with the labor shortage and the workforce being the way that it is right now, I said, you know what? Let's get some people, let's flood the workforce with some people who have the knowledge, who have the skill set to be able to take care of themselves. Just like I said before, as a woman, you should never have one source of income. But as anybody, you should never have one source of income. So even if dental assisting is not something that you want to do long term, if you're going to use it as a stepping stone, certainly it's a great place to start. It's a relatively inexpensive field to get into, and you have the knowledge to be able to move to different places in your field. You could go from being a dental assistant to an office manager, to a dental hygienist, to even a dentist if you wanted to.
Wow.
There are lots of dentists that started dental assisting. So it's just a way to get your foot in the door. And I think that it's needed for some people that want to use it as a stepping stone. So certainly it's something that I'm looking forward to.
I think that's absolutely amazing. I mean, you think about what you take in your career, you're learning now the COVID, hold on a second. I do one thing really, really well, but then this impacted what I do really, really well. So now you're taking all your skills and your knowledge, these your years of experience, and now you're opening up this school to touch other lives and have a greater impact. Man, I love that. That's absolutely amazing. I want to make sure that I do it right and give you your flowers, because people are having an impact on a day-to-day basis now, but we're not being seen and we're not being heard. But I want to make sure, and I'm gonna get your social media handles, because I want people to follow you and see the content that you put out, because I follow you myself, and I love your LinkedIn and your Instagram. So you know what? Let's go ahead and do this. Where can people follow you? Because they need to get this information.
You can follow me on Instagram at Dr. Fatima Robertson, or you can follow me on LinkedIn at Fatima Robertson DDS.
And that's Fatima Robertson, guys. Give it to him one more time, Dr. Robertson.
On Instagram at Dr. Fatima Robertson, or you can follow me at LinkedIn at Fatima Robertson DDS. Jarvis also have a TikTok. It's at Dr. Fatima Robertson as well.
Okay, so she has a TikTok, and it's pretty easy, guys. And I'm gonna try to make sure that I put the links on the in the comment section as well. Okay. So TikTok, give us the TikTok one more time. I'm sorry, Dr. Robertson. I want to make sure they follow you.
They're actually the same. TikTok and Instagram are both at Dr. Fatima Robertson.
All right. So last question for you.
Yes.
What advice would you give your 15-year-old self today?
Oh, man, persevere, girl. Persevere. There are all kinds of things that are going to come and challenge you, but persevere. Keep your eyes closed, keep your head down, and just keep moving. There's something that Steve Harvey said. He said, if you're ever going through hell, why would you stop? You got to keep going through to get to the other side.
Persevere. If you're ever going through hell, why would you stop?
Yeah, don't stop. Why would you stop?
Dr. Robertson, I look forward to hearing from you and seeing your success out there, because as you build this empire, when you get the school up, how about we bring you back to talk about the school? And yeah, we got to have you back to talk about the school. And you said around June or July? July. So I will put on my calendar to follow with you around that time, so we can get you back to talking about, are you going to have a grand opening? Maybe we can promote the grand opening, have people come out.
Yes, Jarvis. Thank you so much. I really am. I'm going to have a grand opening. I would love to have you out.
So we'll talk about that and more. But I want to say thank you so much. Guys, please make sure you go and follow Dr. Robertson, because the information that she gave us today, she can go a lot deeper, because we had some conversation in the green room. And trust me, it gets deep. So we gave you surface level. But to make sure you brush your teeth every day and floss before you go to bed. And then if you guys are thinking about a career change and trying to learn a skill, Dr. Robertson is about to open up a school that you want to be a part of. All right. So Dr. Robertson, thank you so much. Look, I look forward to having you on again to talk about the school. Guys, as always, you know what to do. Be sure to like and subscribe. Until next time.